So I guess we should wait a few more minutes and let people come in.
Recording.
For those of you who are coming in, we're just waiting a few more minutes to let people come in. Okay, so I think we'll get started. I'm not sure. It looks like when people are trying to come in, they're going into a waiting room. Abel and Tessa, are you seeing that also?
Yes.
Okay. So I would say whenever one of us is talking, if one of you happens to see that pop up, if you wouldn't mind just admitting people, then I won't feel like it's coming up all the time. Okay. So hi, everyone. Thank you so much for joining our panel this afternoon. This panel is in part based on a report that we released. Well, I should introduce myself. I'm Laurie Bayronavand. I am the director of the Center for Agriculture and Food Systems at Vermont Law School, and also a professor. On our panel today, we also have Abel Luna, who grew up as a farm worker, working since he was a teenager. He worked with the Rural Migrant Ministry in New York as an organizer, fighting with farm workers and allies to win groundbreaking legislative improvements for agricultural workers, including improving minimum wage laws. He's now an organizer at Migrant Justice, an organization based in Burlington, Vermont, that's both founded and led by farm workers. And since 2009, Migrant Justice has led a number of groundbreaking campaigns for human rights and economic justice, including Milk with Dignity, a worker-driven program to ensure human rights for farm workers in the dairy industry. And I think Abel is also on a panel tomorrow about some of the other work that Migrant Justice is doing. We also have Tessa Pulaski. Tessa joined Farmworker Justice in 2021 as a legal fellow. She monitors policy developments on immigration, labor, and health issues, and provides legal research for Farmworker Justice's initiatives in these issue areas. Prior to coming to Farmworker Justice, Tessa was an intern at the Center for Agriculture and Food Systems at Vermont Law School, where she contributed to the report, Essentially Unprotected, a focus on farm worker health laws and policies addressing pesticide exposure and heat-related illness. Tessa is a graduate of Georgetown School of Foreign Service and the George Washington University Law School. She is passionate about the intersections between climate change, food systems, development, and migration. So this presentation, in part, comes out of the report that was referenced in Tessa's bio. Tessa was really instrumental in helping to research that report. Isabel and others at Migrant Justice helped to provide some feedback on that report. So did some advocates from Farmworker Justice, in addition to a number of other organizations. So Tessa and I are both going to talk a bit about some of the research from that report, and then Isabel is going to talk about the Milk with Dignity program as a great alternative to thinking about legislative solutions and fixes. If any of you have any questions as we're talking, please feel free to type them in the chat. After we're finished with our presentations, we're happy to open it up and have a conversation with you all. So if there are things that you think of while we're talking, just feel free to pop those into the chat. Okay. Great. And Tessa and I are sharing a PowerPoint. So she's going to move through.
Can you see the presenter display or the actual presentation?
I see the presenter display.
Okay, let me switch it.
That's perfect. So on this slide, I have to mention, actually, which I didn't, the report that we created from the Center for Agriculture and Food Systems was a companion report to a report that came out of the Johns Hopkins Center for a Livable Future, Essential and in Crisis, which was a review of public health threats facing farm workers in the US. For anybody who is on this call that does advocacy work, that report is really great at pulling together a bunch of the public health literature on the public health threats facing farm workers. It's a great resource if you're looking for some of that information. So I would recommend taking a look at it. Tessa, you can go to the next slide, please. So I'm going to give you all an overview of the federal laws that pertain to pesticide exposure and heat stress, primarily facing farm workers. There are other health and safety issues. I'm hearing a little bit of feedback. Are you guys hearing that too? I don't know. So I'm going to focus in on pesticide exposure and heat stress, and not that those are the only health issues that farm workers face and that the law attempts to deal with or should deal with. But when we met with advocates, those were the two that they suggested were priorities and issue areas to focus in on. So that's why those are the two areas of focus. And so for anybody who doesn't know about the Center for Agriculture and Food Systems and who we are based at Vermont Law School. We work with law students and master's students on issues across the food system. And we do that work in partnership with food system organizations so that we can help to develop resources that empower the communities that they serve. So here are some statistics about farm workers in the US. We know that there are an estimated 2.4 million farm workers in the US, but that's likely an underestimate. It's difficult to get true statistics of what the numbers are. Approximately 75% of farm workers are immigrants. The average farm worker makes between $20,000 and $25,000 a year. It doesn't necessarily mean that they take home all of those wages, because farm workers also face rampant wage theft. 33% of them had family incomes that were below the poverty line. The average age of farm worker, or the average farm worker, has worked 16 years in the industry and is highly skilled at the profession. 55% of them have children, and 40% were living apart from all nuclear family members at the time that they were interviewed for these statistics. Something else that's really important to consider about agriculture as an occupation. Agriculture is considered one of the most dangerous occupations in the US, yet OSHA, the agency that addresses workplace safety, has very few standards in place that protect agricultural workers in general. And farm workers as a group, given the composition of the population, is at higher risk because often they're worried about expressing concerns, either for fear of deportation or other forms of retaliation. So some of the different workplace hazards that they face include injury from heavy machinery and repetitive motion, also illness from exposure to zoonotic disease, if we're thinking about workers that are dealing with animals. And then pesticides, exposure to pesticides and heat. And for migrant farm worker women, there are significant reproductive health issues that are very common. Children working in agriculture amount to less than 5.5% of working children in the country. So that's across all sectors. Yet they suffered 52% of work-related fatalities. So a high incidence of work-related fatalities for children that happen to be working in agriculture. Farm workers also often lack access to or can't afford health care, both because of their extraordinarily low wages and the rampant wage theft that they often experience. And climate change has exacerbated some of these conditions due to increased extreme heat and pesticide usage to combat the rising spread of pests. And yet, despite all of these significant risks, as I said a few minutes ago, farm workers and other agricultural employees are often excluded from many labor protections at the federal level, also in many states, due to our nation's long history of a food and agricultural system rooted in enslavement. So as far as the legal and regulatory framework goes for pesticide exposure and heat stress, normally when we think about labor standards, we think about OSHA, or the Occupational Safety and Health Administration. That's an agency within the Department of Labor. And traditionally, OSHA is the agency that's responsible for setting standards in the workplace. So in your workplace, if there are specific things that your employer has to comply with, like specific signage that you might see around your office or your workplace, a lot of that is because of standards that OSHA has put into effect. There's one interesting provision in the law that gave OSHA its job, which is the Osh Act, that basically says if another agency creates a standard that regulates workers or provides for standards for workers, then OSHA is prevented from doing that. So what we see, at least with regard to heat stress and pesticides, is that OSHA could set heat stress standards. They haven't yet. They just opened up a rulemaking to do that and to create a heat standard. But for pesticides, the EPA, the Environmental Protection Agency, is the agency that essentially took over regulation of federal farm worker protections related to pesticide exposure. There was a little bit of jostling many years ago between OSHA and EPA with regard to pesticides. OSHA was getting ready to create standards to protect workers from pesticide exposure, and EPA sort of swooped in and took authority over that particular issue. So EPA does that through what's called the Worker Protection Standard. And when they decide to change or amend the Worker Protection Standard, they open that up for public comment so that people can send comments about what they think should be included. in the worker protection standard. And so basically, for most things, the reason the EPA is the agency that that thinks it should regulate worker safety related to pesticides is because the EPA regulates pesticides more generally. So they regulate the registration of pesticides, the safety of pesticides, the labeling of pesticides. And generally speaking, the EPA standards set the floor. And if states decide that they want to be more protective, states can do that. The one area that states cannot create any sort of different standards is with regard to pesticide labeling. And that actually creates a problem. If a state wanted to be able to create a more accessible label on a pesticide and to potentially put different languages on that label to make it more accessible to the farm worker community in their area, they're actually prohibited from doing that. But generally speaking, if a state wanted to engage in other types of protections, they can do that. And Tessa's going to talk more about that when I flip it over to her. So in many instances, due to concerns that federal safeguards don't protect farm workers, states have actually taken the step of creating laws and regulations intended to address some of those gaps that they see in federal law. So the Osh Act is the federal law that gives OSHA the authority to create occupational safety and health standards. And those occupational safety and health standards are federal regulations, so employers are required to comply with them. At some point, or maybe some of you are familiar with things that OSHA does, OSHA also creates what's called guidance. So if there's not a binding standard in place, sometimes OSHA will create a guidance that they send out to employers and say, if you want to address this particular issue, we think this is how you should go about doing it. But because it's guidance, it's not binding on the employers. So for a long time, OSHA has had in place standards related to heat stress or heat-related illness, or not standards, I'm sorry, guidance in place related to heat stress and heat-related illness. And there's long been a push from advocates for them to formalize that into a set of binding regulations. The Osh Act also has what's called the general duty clause, and that's sort of a fallback. It's a fallback within the act that basically says employers have this general duty to provide a workplace that's free of hazards. And even though that sounds like potentially that might be a way to get OSHA to enforce certain violations that they might see, it's actually somewhat difficult for OSHA to issue citations under the general duty clause and have those be upheld. And according to the 2017 US Census of Agriculture, there were 93% of farms that employed approximately 1.2 million workers that were exempted under the Osh Act. So there's also an exemption under the act that basically says if you have a farming operation that employs 10 or fewer employees and doesn't maintain a temporary labor camp, you're exempted from the limited standards that they do have in place. And that might sound like it's like when you actually read the standard, it might sound like, oh, that doesn't really apply to that many people. But if it applies to 93% of farms that employ approximately 1.2 million workers, that's almost half, going back to the first slide, almost half of workers that we know of in the US that are exempted from any OSHA enforcement and investigation. So even though OSHA hasn't developed any standards at this point to protect workers from heat hazards, they're in the process of doing that. And for any of you that are that are listening, I would encourage you to think about submitting comments in response to the agency if you have any specific thoughts about what should be included in a standard like that. Fifra, so Fifra is the Federal Insecticide, Fungicide, and Rodenticide Act. It's a mouthful, but that is basically our federal pesticide law. And Fifra is the statute that essentially, or the law that essentially gives EPA the authority to regulate pesticides. So in addition to the worker protection standard that EPA has created, EPA also registers all pesticides that are sold in the United States. It requires that applicants who are trying to get a pesticide registered can show that the pesticide won't generally cause unreasonable adverse effects to the environment. But when thinking about whether an adverse effect is unreasonable, EPA has to think about the pesticide's economic, social, and environmental risks and benefits. So it doesn't mean that when EPA is engaged in a risk assessment that they're only thinking about what the risks to health might be associated with that particular pesticide or the risks to the environment. They're balancing that with what they think some of the benefits might be from an economic and social perspective. EPA has also stated that they interpret that requirement to mean that they aren't required to balance the risks and benefits for each exposed group individually. And they note that the pesticides may present a high risk to workers, but they say that those risks have to be balanced against the economic benefits to society. And because they don't have to think about each exposed group individually, that means that risks to farm workers aren't really, they're factored into their calculus, but they're not factored into their calculus based on the rates of exposure that we're seeing in farm workers. And EPA doesn't consider chronic exposure for certain industries, risks that might be specific to pregnant women and children, or even the interactions between multiple pesticides. So if a worker is working in a field where there are multiple pesticides being sprayed, EPA isn't assessing the risk of the interactions between those multiple pesticides when thinking about risk assessment and deciding whether to register a pesticide and determining how much of that pesticide can be applied safely. And then after registration, pesticides still may be subject to labeling, packaging, storage, disposal, and transportation requirements that EPA would put into place for them. So in 1974, EPA developed the Agricultural Worker Protection Standard and has amended it several times since. So you can see on this slide, it's a little bit small for me to see, even with my glasses on. But you can see what some of the major components of that standard are. And the Worker Protection Standard is the main federal law that's intended to address risks associated with pesticide-related illness and injury. So according to EPA estimates, the standard applies to more than 2 million farm workers on more than 600,000 farms. And even though EPA creates this standard, states have the primary authority for enforcing this standard. So it's not that that federal EPA workers are coming onto farms and ensuring that the worker protection standard is being enforced, but rather the states, with the exception of Wyoming, that are doing the actual enforcement of the standard. So one of the, I'm not going to talk a lot about this because Isabel is going to cover this in his presentation, but one of the big issues that we hear a lot about in this particular industry, and this isn't necessarily unique to this industry when we think about enforcement, but so Tess is going to talk a little bit about how states have tried to fill in some of the gaps in federal law. And some of the gaps in federal law are obviously that like OSHA hasn't created standards that we need to protect workers. There are people have issues with the worker protection standard in the sense that it's not actually protective enough. And a lot of it is focused on PPE and trying to think about how to mitigate exposure, but not necessarily how to prevent exposure in the first place. And so what we hear a lot is that we have this federal structure in place. States have tried to fill in some gaps, but overall, we still see issues with enforcement. And we see that workers aren't always going to report violations, even if there are some, because of fear that they have of retaliation. And those fears are obviously not unfounded. And so as alternatives, which you'll hear about from Isabel, there are market-based measures where workers have essentially created their own sets of standards that they can then enforce through private law or through contracts, which is a great way to not only take over the standards, but to also take over enforcement and ensure that you're not relying on the state or some other government agency or body to be the person that's enforcing, and to hope that that enforcement is going to be a priority for them. So these pictures come out of our report. And so these were some of the recommendations that we made at the federal level, and some of them are really specific. Some of them are sort of more generic. One of the big ones, obviously, was that we said that there should be that the EPA should revoke all tolerances and cancel the registration of chlorpyrifos, and that has actually happened, which is pretty exciting. That was a pretty big victory for advocates. And also, one of the other big recommendations that we made was that there should be a proposed federal heat safety standard, and OSHA is now in the process of doing that. So that has, we obviously are not responsible for those things. There's a lot of advocates that worked really hard to make sure that those things happen, but it's nice to see that in the short time that this report was published, and now that two of the really big recommendations that we made are actually, one of them has happened and one of them is on its way to happening. So it's pretty exciting. So I will pass it over to Tessa to talk with you all a little bit about how the states have tried to enact laws and regulations to fill in some of these gaps.
Yes, so thank you so much, Lori, for that fantastic federal overview. I'm now going to discuss state laws addressing pesticide and heat exposure. And my name is Tessa Pulaski, and I served as a summer intern at the Center for Ag and Food Systems at BLS and got to work with Lori on this report. And now I'm serving as a legal fellow at Farmworker Justice, which is a national organization that partners with farm workers and farm worker organizations to provide legal advocacy, policy analysis, training, and technical assistance to farm labor unions, farm worker organizations, to other organizations. I just wanted to quickly mention that this presentation does not reflect the views of FJ, but are my own. So first, I'm going to talk about state laws on pesticide exposure. So there's not one type of law that addresses pesticide exposure, and they can be multifaceted. And state laws on pesticide exposure can go from before which pesticides even get to be applied in the first place to how these pesticides affect farm worker health. So for context, in our report, we looked at 13 states based on the number of farm workers, the largest number of farm workers per state per region. So New York was the largest state in the Northeast region. We don't have any of the states in New England, but we're hoping to do more research into these states as well. So in terms of different types of policies, we identified 4 buckets. So bans on certain pesticides, pesticide drift prevention, restrictions on use and application, and then pesticide exposure, illness, and response. And as Lori mentioned earlier, even though we kind of were wanting to compare policies and develop parameters for the strength of policies, we also acknowledge that so much of the policy can hinge on implementation and enforcement. which repeatedly came up as an issue. So even though there might be certain regulations on the book that seem stronger, we are also aware of that. So one example that Lori kind of alluded to in terms of like language accessibility would be California has a stronger regulation because the language says that the potential hazards and pesticides must be communicated to the worker in a manner that the employee understands. So that could be interpreted to provide for better explanation for low literacy workers or workers who may be only able to communicate indigenous languages. Whereas some other states just say, you know, it has to be available in English or Spanish, or you don't have those same, they don't account for the same issues that farm workers might face in terms of getting this information. And then something like record keeping, which may not seem very interesting or important, it can also be really crucial to see how long these records are kept or what happens like with pesticide use keeping. Like, is there someone in the state that's kind of keeping track of all the cases of pesticide exposure? So going back to the first bullet, bans on certain pesticides, Lori also talked about this, but chlorpyrifos was banned, which is very exciting, in August 18th, 2021, so very recently. And for more context on chlorpyrifos, it's a highly neurotoxic insecticide that was developed from World War II nerve gas. And in addition to developmental dangers it poses to babies, it can cause dizziness, vomiting, convulsions, numbness in the limbs, and loss of intellectual functioning, and even death. And it's a frequent thing that farm workers are exposed to. So several states, you can see on the left, Hawaii, California, New York, Maryland, and Oregon had previously taken some state action on chlorpyrifos in different ways, but then finally the EPA decided to ban it, and I think the rule will go into effect in 6 months. But even though there's other organophosphates that should still be banned, it's nonetheless encouraging to see this change. And this has been, decades of advocacy around this, but I think some people would argue that because of the state policies, it led to more federal action. So now transitioning into heat policy, another state policy that has kind of up until now kind of been stronger than the federal level is the Maria Isabel Vasquez Jimenez heat illness standard in California. So this is also from our report, this language, but in 2008, a 17-year-old farm worker passed away after she'd been working in 95-degree heat and had repeatedly asked for breaks. And the strict foreman didn't allow her to get a drink. And then she collapsed in the arms of her fiance. And they actually found out that she was 3 months pregnant after she had already arrived to the hospital and was in a coma. So afterwards, a group of the United Farm Workers marched 50 miles from the farm to Sacramento, carrying 2 wooden coffins, and protested in the California legislature to strengthen the heat standard that was on the books, because they had had one as early as 2006. So now California has stronger requirements for outdoor workers. So employers must provide 1 quart of potable drinking water per worker each hour, shade and recovery breaks, access to emergency medical services. And there's also additional provisions that kick in when the temperature reaches 95 degrees. And workers also need to be compensated during the mandated rest breaks, because sometimes there's issues if workers fear taking a break or don't want to take a break to lose additional money. And while California has a strong standard, there's still a lot of advocates we spoke to in the process of writing this report who think it should be changed and further strengthened. And as you've seen in the news, probably workers have continued to die during worse and worse heat waves out west, but increasingly all over the country. So in terms of components of state laws that address heat-related illness, there's kind of 5 factors that make them that they must account for. So the first is acclimatization. So that's transitioning from cool to warm temperatures or warm to cool. And that's often how heat illness or death can happen. And then for temperature, temperature thresholds sometimes only account for the dry temperature level and not necessarily humidity. So 85 degrees can feel really different if you're in, a dry part of Arizona versus in the Northeast in the summer, where it can be a lot more humid. So that's one thing that the heat standard should better account for. Also more frequent breaks, depending on the temperature, and going back to that humidity or the humid and dry temperature as well. And then proximity to shade and water are also really important, because, for example, the California regulation does not set a minimum distance for access to shade and water. So that would be one way to change it. And then we also spoke to some people who said that during COVID, there's been a complicated factor with shade because you also have to account for social distancing. So it's been hard to have adequate shade when you also have to make sure people are distanced. And there's also an issue with quality shade. So sometimes other like crops have been used to provide shade versus having a large tree. So what kind of constitutes quality shade is also very important. And then of course, making sure this is all enforced. For example, California, which has a standard, it's enforced by Cal-OSHA, and they have a memorandum of understanding with several nonprofits and rural legal assistance groups to kind of enforce it better, because Cal-OSHA is woefully understaffed, and even if they wanted to, it's very difficult for them to enforce the standard across the largest agricultural state in the country. So Lori mentioned this earlier as well, but climate change is exacerbating the intensity and frequency of heat exposure. So we saw these images of farm workers this previous summer working in wildfires. So you also have like the additional factor of smoke inhalation while you're also wearing PPE for COVID. It's just been kind of like a hellscape of what we've been seeing for farm workers. And then also there's interplay with pesticide exposure. So Lori also mentioned this a bit, but pesticides can make heat can make pesticide exposure worse because it makes pesticides more volatile, and then there's actually increased usage of pesticides necessary sometimes if heat is if there's drought and they need more pesticides to kind of cultivate more crops. So this is not, it's a difficult period to be moving towards with climate change because these issues are only going to get worse. And kind of coming back to the focus of our conference, the Northeast, we haven't seen as many issues around heat exposure in the Northeast as of yet, but that is just due to change with rising temperatures. And Isabel can maybe speak to more of the situation right now in Vermont, but this is only going to get worse. And I think it would be great for the Northeast to kind of also address this. So Lori also mentioned this earlier, but this was exciting. But this Biden administration announced an interagency movement to address heat illness in the workplace, because currently, I forgot to mention this, but only Washington and California have outdoor heat standards. Oregon issued an emergency one last summer, and then Minnesota has an indoor one, but very few states have any policies about this. So now there's a rulemaking that's starting, and I included the link at the end of our presentation if you want to submit a comment about it. But the people, I think I would say advocates are cautiously optimistic about the new policy, kind of knowing that there will continue to be issues with enforcement, and then seeing how this will actually play out. And once again, with the floor and ceiling thing that Lori mentioned earlier, the federal heat standard would kind of set a baseline for what states have to do, but then states could kind of go above and beyond that in terms of requiring even more shade and rest breaks, and requiring more adequate compensation with higher temperatures or different things like that. So there's nothing that, even if a federal standard happens, I don't think that should take away from movement towards advocating towards state legislatures in the Northeast about how we can increase protections for farm workers working in extreme heat and also working with pesticides. So then finally, here are some recommendations for actions at the state level from our report. I also linked to the report at the end so you can read them more and more in depth. And yes, overall, I'm excited for Isabel to speak next, because overall it was we continually were finding that enforcement was the issue. So we want to really figure out how agencies can better do that. And especially through the first bullet of identifying a lead officer agency to actually identify and address issues related to farm workers, which would be great. Because as Lori also alluded to, there's a lot of different agencies working on this, and sometimes things can get lost in communication between agencies, and this hasn't always been the group that's been most prioritized in agriculture in our government. So yes, bring these recommendations to your own states, and hopefully New England will continue or will begin to start to be a leader on these issues. And here's for some additional information. And then that's the ANPRM stands for Advanced Notice Proposed Rulemaking, basically jargon for saying that they've started the process for rulemaking. And here are my email and Lori's email. So thank you so much.
All right. Yeah. Thank you, guys. This was Larry and Tessa for all that information. I'm going to share my screen. You guys can see the screen now, probably. Okay. Yeah, again, thank you so much, Tessa and Laurie. Thank you guys for joining us. I know some of you guys just recently have joined. My name is Isabel, an organizer with Migrant Justice. It's a pleasure to be here with you guys, everyone. Special thanks to NISOC for allowing us to be part of the conference and just share a little bit of the work that Migrant Justice is doing. Just to briefly share a little bit about Migrant Justice for those of you that don't know too much about Migrant Justice or haven't heard about Migrant Justice. It's a farm worker-led organization. That was started in early 2010 after the death of a young farm worker named Jose Obed. Basically his death was the spark among the community to come together, to start organizing, to win concrete campaigns to come out of the shadows where people were. But that's sort of a little bit of the history of Migrant Justice, and basically the mission of Migrant Justice is to build the voice of the community, the community building the voice of the community, to make transformations into their industry, win human rights and economic justice, and in order to do that, we work together with allies, in order to achieve some of the things that we do. Well, so just to, getting into the middle of the conversation, why is it, the Migrant Justice exists, or, why is it that we do the work that we do, in the way that we do it? And for that, it's important to understand, a little bit about the dairy industry, which is where we focus, our work. Migrant Justice is organizing dairy farm workers in the state of Vermont. And some of the things that we have learned, is that 80 to 90% of the farms in Vermont are hiring migrant farm workers to sustain the farms and the dairy industry. And some of these farms are really small, they're isolated, they're invisible, and so the conditions are ripe for human rights abuses. And one of the things that we did early in 2014, 15, we did 2 surveys, and basically some of the things that we did, it was a worker-to-worker survey, worker-to-worker, workers interviewing other workers. And some of the things that we learned was, for example, that about half of the workers that we surveyed were not getting the Vermont minimum wage. So they were earning very little money. Some other things is that 60 workers are working 60 to 80 hours per week. And we're talking about working 12 hours, 14 hours, without a day off, sometimes without even having a lunch break. For those of you that don't know, if you're a farm worker, a migrant farm worker in the state of Vermont, or in other states, it is similar in some cases, but you're working on the farm and you're also living on the farm, so you never get to leave the farm. That's what you do, a routine. And some of this housing, as I mentioned, some it's isolated, some of the housing is old. There is, for example, lack of heating, lack of water, drinking water. Sometimes, there's no, restrooms or restrooms that are working for people to use, or the showers. People, sleeping 2 to 3 people per room, from, on the farms. And so those are some of the things that we, learned through the survey that we did. Laurie and Tessa mentioned, accidents with chemicals. In the dairy industry, you're working, all of the time with chemicals, different kind of chemicals, or food baths for the cows. So workers are, in constant, around chemicals all day. So there's a lot of accidents due to that, due to machinery, animals. And because farm workers are excluded from labor laws, labor protections, there is sexual harassment, there is human trafficking in some cases, and those are some of the things that we have learned through the survey that we did. Once we did the survey, we learned a lot of these different issues that were happening in the community. We had a huge questions on what do we do? Do we go to the state of Vermont and talk to the different agencies and see how they can actually do something about these conditions, or these rights that are being abused, or do we find something else? So we sat with the Department of different agencies in the state of Vermont, Department of Health, Housing, and some others, and we showed some of these results that we had. We asked what can the state of Vermont do, and then to our surprise, they couldn't. It wasn't a surprise, they couldn't really do much. They didn't have the power or the capacity, to enforce some of the laws that already exist for workers. They're not able to enforce it. And so after hearing that, we were faced with the same question. Well, what do we do? And for us, it was about enforcement. There are laws, there are protections for workers, but it comes down to enforcement, whether the state can enforce those those rights, those laws. And that for us was the main sticking point. And so we started to look for different alternatives. And so we came across the Coalition Mocali workers, with the Fair Food Program. Just some of the pictures, some of the farms, and so we came across the Coalition of Mocali workers. They have they have the Fair Food Program. And they have, which is the third party mechanism, or the enforcement mechanism of the program, the First Food Program. And we saw that they had something that we wanted, and so we went down to Florida. We started to develop a relationship with workers, to learn about the model that they were using, I'll share a little bit about that in a bit. But so we were first faced with all of these different results, and so we didn't know what to do then. And so when we started looking for the models, one of the things that we started to do was to look at corporations as well. When we heard from Sarah Vermont that they couldn't do much, we started to look at corporations, and corporations, we need to understand how they work in order to sort of understand how they play a role in our everyday and the way they impact workers. So at the very bottom you have farm workers, and as you go up the supply chain, on the screen you can see like a little pyramid. It's like a corporate supply chain, an example. And so at the very bottom you have workers. As you go up you have farmers, co-ops, processors, and at the very top you have corporations. Throughout the years, the decades, corporations have, gotten stronger. They have gotten a lot more bigger, so they have a lot more buying power. so they can, pretty much tell farmers, what to do. They can decide on what is the price of milk that they, want to pay. And so, they're creating they're creating, pressure from the top to the bottom. And so a lot of the conditions, that we face on the farms is because corporations don't, are not paying, farmers the right amount of money for the milk. So even when farmers want to do the right thing, like improve wages, create better housing, better working conditions, they run into economic obstacles because of this. That's when we came across the coalition of locally workers, learned about the model, and started to ask ourselves, well, can we implement this similar model in the state of Vermont? That's because part of the issue for migrant justice was that even if there are new laws or new protections that the state comes up with, they don't have the power to enforce it. So we were looking for something different, something else, and this was a solution for us. Looking at corporations as being part of the solution. And since then, we have started working and bringing the model into Vermont. Creating the Milk with Dignity program, and the program really solves the the whole problem from its root. Takes into account the entire supply chain, and the way it works in Vermont or with Migrant Justice is that Migrant Justice sits at the table with corporations, such as Ben & Jerry's, for example, which is a corporation that has signed onto the program. Then that corporation signs a legally binding agreement with Migrant Justice, and then they decide to bring on the rest of their supply chain. Once their supply chain joins, the corporation starts paying down their supply chain. So the farms that are selling milk to Ben & Jerry's will receive a premium, and in order to receive the premium, they have to commit to use that money that is coming from the corporation to respect the code of conduct that workers created themselves on the Milk with Dignity program. And for example, if the farms that are receiving this money, in order and they need to put it to something on the farm, if there's wage issues or housing issues, and if they don't do it, the last resource is that the Milk with Dignity Standards Council, which was a third party organization created by Migrant Justice, is the enforcement mechanism of the program. They can suspend them from the program, if farms are not complying. But they before suspending a farm, they always try to work with the farm, creating specific timelines, to comply with the code. And yeah, so that's a little bit of how the Milk with Dignity program works. So the first corporation that joined the program was Ben & Jerry's. The Milk with Dignity program is being implemented in 100% of the supply chain, meaning about 20% of the dairy industry here in the state of Vermont. And they signed on 2017, so the program has been going on now for 4 years, and then things are starting to change. There's a lot of good things that are happening on the Milk with Dignity program, and I'll try to wrap it up very briefly. For example, one of the things that if you guys want to go on the Migrant Justice website, migrantjustice.net, you guys can read a report that came out for the first 2 years of the program, which talks a lot about the changes and the things that have happened. But just very recently, we released a third report, which is focuses a lot on sort of the health and safety aspect of the program, especially during the pandemic. And although the Milk with Dignity program wasn't really designed with a global pandemic in mind, there was no COVID when the program was put together. The mechanisms, the enforcement mechanisms, and the way the program works, it's what actually make it actually perform really well during the pandemic. And so farms that were under the Milk with Dignity program, for example, if there were workers that were sick with COVID, they could take days off. They could, stay home and get paid for that day, pay sick days. And, they could, communicate with the boss about the necessities that they had and the issues that they had. And because of the housing improvements that have been made throughout the years, all of that prevented, community spread. And so, that was happening on the Meal with Dignity farms, but on farms that were outside of the Meal with Dignity program, workers that were, getting sick with COVID, or, they felt like they were getting sick, they were afraid of speaking up and telling their bosses that they were sick because they were afraid of getting fired pretty much. So a lot of people, there's a story of a family that, the whole family got sick. They told the farmer, and the farmer decided to fire the whole family. That was in the middle of the pandemic. They couldn't find housing, so they had to leave the state. But those are some of the, the things under the Meal with Dignity program. There's actually protections, that workers have. And just to share a little bit more, what are some of the changes that are happening? Well, over close to $2 million have been passed down to farmers and farm workers packets through the program. And there's a little bit of the breakdown. You guys can see on the screen a little bit of the breakdown of the numbers on exactly where some of those things have gone to. But a lot of it is housing, changes in vacations, paid sick days, workplace improvements, paid vacations, so those are some of the changes that are happening on the program. And one of the things that we want to do, we want to expand the Meal with Dignity program to other supplies, other companies. And we have an active campaign calling Hannaford to join the Meal with Dignity program. Hannaford, it's a corporation that has about 200 stores in the Northeast. They also belong to a multinational corporation called Ahold Delhaize, which is a Dutch company, bringing home about $75 billion a year. So $75 billion, $1 billion a year. So they have the money to join the program, and to do the right thing, and be champions for human rights in their supply chain. So we've been since last year, we've been at it since last summer. Sort of calling Hannaford to join the Meal with Dignity campaign. And we have been doing a lot of work in the past sort of year and a half through the pandemic, and a lot of actions, calling, letting Hannaford know that they need to do the right thing. And oops. Yep, and yep. So one of the things that we have been doing is putting pressure, a lot of pressure on Hannaford to join. They have not responded. After 2 years. So we have engaged a lot of allies and a lot of different people, consumers across the Northeast, across the country, to take action and call Hannaford to join the program. We've done rallies, marches, and a bunch of different things, to let Hannaford know that they need to do this. But they haven't done so. So we continue to to put pressure on them. One of the things that we want you guys to do is to take action. If you guys have the time after, or if you have the time now, one of the things that we want you guys to do is to go on Facebook and look up Hannaford supermarkets and just type something in solidarity, like Hannaford, it's time to join the Meal with Dignity program. And so these are an examples of some of the things that people have done. They'll put up a picture, especially workers working on the farms, putting up pictures and stuff like that, or just comments from allies, so that Hannaford keep hearing from us. And yeah, I think that's a little bit about the Meal with Dignity program. And I guess coming back to like the main question of why we could have done something legislative versus why did we go with a corporate campaign. and it was that a lot of the for us it came down to enforcement, right? If there's no enforcement, we can create the best law on the state, and but if workers, if there's no education, then workers are not gonna know about it, and workers are gonna be afraid to speak up, if there's no consequences when human rights are violated. So that's why for us it was really important, once the state said that they don't have the power or the capacity to enforce anything, that's why we needed to look for alternatives. And sort of the movie dignity program, or the WSR model was the solution for us. Yeah, so I think I'll leave it at that, and thank you guys for your time. And we can open it up for questions.
Thanks so much, Isabel and Tessa. It looks like we have one question that's many questions in one of the comments. One of the questions, the first question in the question is, would a robust public health system that covers rural areas, both workers and farmers, no matter their immigration status, help workers with on-site or mobile health services? Isabel and Tessa, do you have any thoughts about that?
Nothing immediately comes to mind, but
I'm trying to read the question again. I mean, that'll be great. I mean, if there is a health system that can protect workers, that'll be awesome. Currently workers, because of immigration status, it's really hard for them to get any sort of health plan and stuff like that. So if there's something like that, that'll be great. But
yeah, there are, I remember from the research that we did, there are like farm worker health centers. I don't know if that's the right name of them, across the United States. So I know that those provide tremendous support for workers, and that is regardless of their immigration status. I know one of the challenges for workers, so the question about doing it on site or having mobile health services, that would certainly be a huge benefit, because being able to travel and get out to a doctor's office or to any of these health centers that do exist can present a challenge. And for some workers that rely on their employers for transportation, that can be an even bigger challenge for them. So yeah, I think if there was some sort of there's some sort of mechanism to provide for on-site or mobile health services, that would be tremendous. Some of the programs, so some of the things that we looked at in California, where there is pesticide monitoring and reporting, there is, I think that some of that happens on site and happens on farm to ensure that it's happening. So, it isn't consistent across all states. It's certainly not something that's required at the federal level. There's no federal law that says that there has to be, that health services and healthcare have to be provided to workers. But some states have like through their legislatures have funded some of these farm worker health centers. And then some states have requirements for like specific health concerns, where that's being monitored and considered by the state. Looks like, Karen, did you have a follow-up question?
I just wanted to, I'm from Oregon, and the state did mandate these mobile health clinics and inclusion of immigrants and undocumented workers in the state health plan in response to COVID. And I just would encourage federal movement to have that the state health plans take on rural areas through a robust health department that goes into rural areas, that moves around rural areas to where people are working and living. And I want to remind people that 40% of the budgets of all federal cabinets, Department of Transportation, Department of Agriculture, Department of Health, is supposed to be directed at underserved populations. And this would certainly be one component of doing that, is to have a public health system that actually provides the services, but also the access to workers, I think, is essential for monitoring health, monitoring safety, because Department of Labor can't keep somebody from getting beaten up, but the local police department or the FBI can. Okay, so, when you're talking about public safety, that means anybody in the public, it doesn't matter where you're from or where you work, you should be legally protected for safety of your person and your family. And so to call on these Department of Justice, for example, if there's a lot of people that are facing violence, even from their employers or from the, whatever's in their life system, we need to really all work together, and they have budgets to do all of this stuff under this president and under the current government. I think they're looking for ways to spend their money. So let it be for people who really have the least in these kinds of services and perhaps need them the most, because when we all help them, those people and those industries, we help ourselves, because they're not making widgets there. That's our food supply. So it helps everyone.
Thanks, Karen. One thing that reminded me of is rural health access to healthcare in rural areas is already a challenge. And then when we think about that for farm workers, that's an even bigger challenge. So it's certainly something that I think is worth paying attention to and advocating for. There's also, just to pick up on a thread, there are many opportunities. I know a lot of you that attend the NESAG conference work in the food system, you work in advocacy. There are so many opportunities right now for people to provide input to the federal government about issues related to equity and justice. And then this upcoming farm bill, I suspect that that's going to be a huge component of the farm bill. And farm workers generally haven't been a really big focus for USDA. And so I think that's it's good just to be thinking about it, keeping it on the horizon, and thinking about how to participate in some of those processes to try to get your voice out there and to try to sort of force the government to make some changes. As far as them requiring access, I think the answer to that is no. I mean, I suspect that might be required by some state laws. There was just a case in the Supreme Court that was about whether or not farms have to allow union workers onto the farm. And unfortunately, or whether that's a taking of the farm owner's private property. And unfortunately, the court decided that they don't have to allow union organizers onto their property. And I don't know what the ripple effects of that might be for other types of people coming onto farms and requiring farms to allow access.
As part of my public comment to the Department of Agriculture, it was to ask that the USDA have, since they know who owns the land, okay, many times that's not who's working the land. the owner of the land is a different person. So that the owners of the land give a blanket permission for access for health or emergency warnings or identified emergency conditions. It could be a weather condition, it could be a chemical spill on another farm, or or on their farm for that matter, that health and safety personnel be allowed blanket access that would be obtained far before the event occurred, hopefully. So that they could come in and either warn people or treat people if it is a communicable disease issue. So again, if farm workers or groups can ask for the USDA to get involved in just registering permission with the landowners, because they know who owns the land, as part of their package of or file on each property.
Yeah, I think one of the issues too, and this is certainly something Abel covered a bunch of the data that they were able to collect through interviews. And I think one of the issues in the US is that for policymakers, if there isn't data to support what you're asking for, policymakers often don't necessarily pay as much attention as you would like. And intentionally, it feels like in the US, there hasn't been a lot of data collected relative to farm workers. And so that was certainly something that we were advocating for, and others have been advocating for a long time. Ani, it looks like you have a question.
Hi, it's actually more of a comment, but to start with, thank you for having this conversation. It is really important. I'm based in the Midwest, but we just restarted our MidSog, so we don't have a conference yet. And I'm glad to be able to participate in more conferences that I wouldn't have been able to get to prior to COVID, because it's expensive to get to conferences and to be a part of these conversations. And I've definitely been trying to take advantage of that opportunity. So I'm also a member of the Young Farmers Coalition, and I'm the Midwest BIPOC policy representative, or I have been. We're undergoing nominations right now. And when we were discussing our policy platform, I made a point of, I'm a minority female, low income, and I check a lot of other boxes for things that are priority for me, but I made a point of, making a point of prioritizing immigration and policy and worker protections, because I believe in what's good for the least of us is good for all of us. And if we're not protecting, our critical essential workers, we're really missing a huge part of the conversation. And in the value chain, conversation we were having earlier, they were talking about support and producers and input and stuff. And there's a big piece that's missing, and where's the power? And it's it's in the workers. But they've been disenfranchised because the entire agricultural system has been built on exploitation and disenfranchisement of the workers for the benefit of a few. And that has to change. And that's what I'm really focusing on. You can blame Ricardo. It's only partly his fault, but he really just, lit that fire in me that, if we don't address these really core issues that everything is built on, we're not going to have any sort of changes in this. And one of the comments I asked about the data for the farm workers in the state, in the region, because, I honestly, and I don't mean any disrespect to anyone coming to the conference, and I know it's hard to pick from a number of different sessions, but I'm frustrated because I've seen a pattern of this in not just this conference, but in a lot of conferences where this conversation is not a priority for people, because other things are more current or more sexy or whatever's more hip at the time, but it continues to be the essential conversation that really needs to have the buy-in from people who have influence in other areas. And how do we get the ones who aren't showing up for this conversation to show up for this conversation, and to understand their, part in this conversation, and how they can, make change, and, working on supporting organizations that are, like Migrant Justice, that are led by, those who are most directly impacted, instead of, kind of like, well, it's not directly, something that I do and I don't know, so I'm just going to let somebody else work on it. And I don't know. I don't know that there's really a question in there. It's just kind of frustrating, because it's like I see all of the work and effort and like the passion and the people who are showing up for these conversations, and how do we make this the primary conversation, especially going into the 2022 Farm Bill? And I really think that, this conversation and mobilizing the youth voice, and talking about, like having a better future, I'd like to see, what we can do with that. Sorry, I'm stop.
No, that was great. Thank you, Ani. Abel and Tessa, do you have any comments that you'd like to make in response to the comments that have been, the comments and questions that have come up?
No, the only thing, I just going after your last comment, I think it's interesting, because I think often, like, I've been more in migration spaces than also environmental law spaces, and I think that sometimes those two groups, like historically, have kind of, I don't want to say butted heads a bit, but there's been these different conceptions of like what is the best thing that we're trying to achieve for either like the earth or for people who are, doing this type of work. So I think that's something that I'm not articulating myself well, but that's something that I think is being broken down a bit. But I've also kind of struggled with that as well, especially in this space, the farm worker space.
Yeah, no, I think a lot of the things that you guys share, are right on, and yeah, it'll be great to have more people. But yeah, there's a lot of things happening, a lot of exciting things. But yeah, I guess with the question about I think like legislation, it can be like, well, how can I put it? Like I think we're like tempted, like our mind is like, okay, well, let's just create a law, and let's hope that law sort of does like waves a magic wand, and all of the issues on the farms, will be gone. And as much as we want to trust, the legislative process and the people that are representing us, at the end of the day, we know that they can't do much, and it's sort of hard to to know and sort of have that sort of reality, and that's why we're sort of looking for alternatives, and that is why we're doing the program. That is why other groups of workers, not just in Vermont, in Florida, and other organizations across the US are also organizing under the model, because just the Department of Labor doesn't work. I mean, you're never gonna get your money back, for a wage claim in a year and a half, and that is the reality. And so I guess I'm not saying that it's completely useless, but in a way it doesn't really serve the people, and so one of the key differences on the Meal with Dignity program and programs that come from the similar model, the WSR model, is that basically you are creating your own Department of Labor. We have the Meal with Dignity Standards Council, right, which is the third party mechanism, or the enforcement mechanism of the program. And one of the things that it's on the website is that an average time to resolve a case, for example, unpaid wages is 2 to 3 days. You go through the Department of Labor, it's going to take you over half a year to do that. And so even though we create laws and legislations that are great and look good on paper and sound really good, at the end of the day, if there's no enforcement, nothing's gonna change. And I think that's for all of us as consumers, workers are the ones that are put in front of the table. It's important to keep that in perspective, that there is a limitation on what the law can do, and there's also what can we do? How can we how can we support worker-led movements, right? You know, Migrant Justice or other organizations that have defined their own sort of way of creating a change that, you know, have an analysis of the conditions, and they know exactly the reality, and they know exactly, you know, what it takes to make a change. I think, you know, that's something that we can all sort of do, and you know, it's just our responsibility as consumers, as you know, and so we all eat food, we all eat, and you know, and so I think that's just wanted to share that. I think there's a lot of focus on the legislative piece, but I think there's limits to what it can do.
Have you done any boycott programs, Abel, where you're targeting that maybe the supermarket chain, or even threaten to try to target the supermarket chain as one that you would like to join you in cooperation for health and safety of food? But they refuse to, so let's not shop there. I don't know. Work for Cesar Chavez.
Yeah, we're not. You know, we, like I mentioned, we have a program with Ben and Jerry's. We're calling on Hannah for it right now to join the Meal with Dignity program. They haven't done so, and you know, we're not boycotting them. We continue to put pressure, doing a lot of actions. We had a huge day of action yesterday. I lost my voice because of that. So, you know, but yeah, you know, if you want to take some action, go to the you know, Migrant Justice website. You know, check out some of the things that you can do. But also, you know, if you have a Facebook, you can go to their Facebook and you know, make a little comment. But yeah, I think that's sort of where we are. Not boycotting, but yeah.
I think what's so interesting about the Milk with Dignity program and so effective, and the work of the Coalition of Immokalee Workers is, as Isabel mentioned, and part of the reason why we included a section in our report about alternatives was because we heard so much about enforcement, and I'm a nerdy professor who teaches administrative law. So I know a lot about enforcement, but that's often within the discretion of an agency. So a lot of times states can have really great laws on their books. And I hate to say that it's a token, but oftentimes it does feel that way because there's a law that gets put on the books. It sounds really great. It's providing all these protections, but it's going to an agency that either isn't prioritizing enforcement of those particular standards, or isn't funded, or doesn't have enough personnel. So it's almost impossible for them to be able to do that. And depending on the political climate, it could be that, you know, a more progressive, worker-centered legislature passed the law at some point, and then the administration of a new governor is of a different political persuasion and decides not to put any money toward enforcing those particular standards. So it's really important, I think, you know, to look at models like Abel's, or even to think about how you, when you create legislation, to not just think about what the legislation says, but to think about what the mandates are with regard to enforcement, and whether or not workers have contributed substantially to the language of that legislation, rather than policymakers and a group of policy wonks and people who think about policy a lot. So I think those are really important considerations. Those are things that obviously, if it's a set of private standards that workers are creating and enforcing, then all of that power is in their hands, which is an incredible place to be. So I don't think we have any other questions. Abel and Tessa, is there anything you wanted to say in closing? Any comments you guys wanted to make?
No, thank you so much to everyone for coming. I just added the link to the new comment, or the new proposed rule on federal heat stuff, if anyone wants to submit a comment.
Yeah, thank you guys for joining us.
Annie, do you have a new question, or was that your hand from before?
No, I actually have just one other comment I meant to mention earlier and I forgot. I just wanted to mention the USDA's Diversity Commission and Agriculture Subcommittee. They extended the deadline. I will be applying. I'm working on my resume upgrade right now. But there are a lot of other opportunities as well to engage that you know, like I'm stuck in a state with really crappy, horrible Republicans who are just like the worst ever. And so there's no route to getting any support or any traction working with them. But, you know, working as like advisory panels and like grant review things. You know, Karen mentioned, I believe it's Karen mentioned, you know, the public comment that can be tricky to do, but, you know, there are, you know, a lot of partners that are on these calls that are working on that. And then since you guys are in the Midwest or in the Northeast, sorry, like NSAC and a lot of other organizations, but I know specifically NSAC because I worked with them, has open internships and fellowships that are on a rolling basis for, and it's an opportunity for individuals to go and work with them and really to bring a focus to the things that you're, you know, passionate about and to like make more connections with their network and their members and stuff. It was an incredibly transformative opportunity for me. Out of the, you know, grace of God, I got picked for the grassroots internship in 2018 during the, you know, writing of the Farm Bill, and being able to be a part of that and really get that in-depth, you know, information. But their team is also really great about making sure that, you know, sitting down and talking to you about what is it that you're here for and how can we connect you and how can we help leverage our resources to help get you connected and get you meetings and get you, you know, like, presenting at hearings and things like that. And if you haven't had an opportunity to do those things or would like any help with that, I would be absolutely open to helping. And you can also reach out to them because their team's awesome. And there's so many organizations, you know, that they work with and that are associated and that are over there. And there's more opportunities now with this administration than there's ever been before. And it's the difficult thing is, you know, having that connection point that can reach out to those in the community who won't otherwise hear of these opportunities and help to make sure that they feel safe participating in this stuff and, you know, that their message is communicated properly. And you guys, just at, you know, acknowledgement for this conference. You guys have done a great job with the language stuff. It's been really awesome seeing how much effort has gone into that. And I know that's such a huge barrier for so much participation for people who are really directly impacted by this. So thank you. I'm gonna stop talking now.
Well, thank you all so much. A special thanks to NESOG for hosting us virtually. Thanks for your participation. Thank you, Abel and Tessa. I hope you all enjoy the rest of the conference. We ended on time.
Bye, everyone. Thank you.
Thank you, guys.
Thanks, everyone. Enjoy the rest of the conference.